Welcome back to the Paws and Effect podcast. I'm here with Dr. Arina. We've just completed part 1, and now I'm going to take the opportunity to really tap into that brain and talk about my favorite subject, which is gut health.
Yeah.
I'm quite passionate about gut health, particularly because I think there is more sort of scientific understanding of the connection between the gut and the whole body system, from brain to skin. And I would just love to sort of get your insight into gut health and the importance of it in our pets. So let me start off with, what is the significance of gut health in our pets?
Well, first of all, it allows your pet to digest and absorb all the nutrients, to give them energy to survive, to give the building blocks for all body cells and functioning correctly onto the best level possible. So secondly, it is one of the largest immune systems. So what you're feeding your pet, or how it reacts to the food, or what process is happening in the gut can reflect on the rest of the body and the rest of the organs, and it can cause autoimmune diseases, allergies, and just in general the well-being of your pet.
So you speak about autoimmune and allergies. Like, what are some of the signs in your pet that their gut health is poor?
Weight loss, vomiting, diarrhea, mucus or blood in stools, poor appetite, lethargy, fatigue, dull coat. So pretty much a lot of signs that your pet is unwell, that all could be related to gut health.
Sure. It's a great subject, isn't it? I can see you like it. So what are some of the causes of poor gut health?
Malnutrition, and when we're talking about the causes, it is most of the time chronic exposure to something. So chronic malnutrition, it is incorrect nutrition or not well-balanced diet. Recent studies showed that feeding raw food can cause the antibiotic resistance bacteria in the gut health thriving. And it is not only a threat to your pet health, but also a threat to your household, to your family, to your kids, to your elderlies, to your immune-compromised people that living in the property as well, and to your vets as well, because there's a lot of bacteria living in their mouth, around their anus, and this is where we examine your pet, and then ultimately we get exposed as well. So that has been linked to antibiotic resistance, the feeding raw food, and it's one of the studies. It's science, you can't deny it, because this food is not processed. So therefore there's a lot of E. coli bacteria that resistant to antibiotics. And we're talking not only about the particular pet, we're talking about the whole humanity, and where we're going with that with regards to antibiotic resistance. Talking about antibiotics, one of the other causes is antibiotic overuse, can also mess up with gut flora, microflora, and therefore will cause disturbances, how the gut is supposed to work in your pet. Food allergies, also one of the common causes, it's a common misconception that people think that allergies is in people, it's more to some unique products like nuts or I don't know, you name it.
Gluten.
Yes, gluten. But in our species, in dogs, it's most of the time chicken and beef. And in cats, it's chicken and fish. So, and people get very surprised when we tell them that this is the most common allergens in our species.
So what can owners do if their vet identifies that their pet has got an allergy to chicken or beef or fish? What products and what options are there out there? How does it work?
So there are hypoallergenic foods that are available. So basically, it's called hydrolyzed protein. So it can be the same chicken protein, but it is broken down to the molecules, the size of the molecules that the gut will not react to. But they have to be very strict, especially in the first 8-12 weeks. They have to be very strict, and they have to feed only this diet and nothing else, which is very hard. No treats.
Biltong.
No biltong.
Food dropped on the floor.
No food dropped on the floor. And then if you have other pets, they ideally either supposed to go on the same diet, or they have to be kept separately, including water bowl, because if your other pet will drink out of the same water bowl as the one that is on food trial, that means that it will be exposed to that protein. It will be exposed to the same saliva. So
I suppose even then it's mutual grooming.
That's waste of money.
I hadn't even thought of that.
How many owners come in and they spend lots of money on that hypoallergenic food, and then they're saying they're being strict, and then when you start asking them, okay, well, what treats do you give? You start sort of triggering, and then they say, yeah, no, I gave chicken and, a Woolworths sachet and chicken. Okay, well, we talked about chicken being a primary source of allergy in your pet. So when we're talking about trials, it is very difficult not to give a treat to your pet, but it is something very important to actually discipline yourself about it, more than disciplining your pet about it. And then once the trial worked, then you can expose them to novel proteins. And it obviously shouldn't be, even in a dog, it could be a fish, it could be a duck, it could be a wild boar.
So novel proteins, something they haven't come across before.
No, something they haven't come across.
So something like venison or novel proteins are generally not included in
normal
the pet
maintenance pet food. Okay. Yeah. And then you start introducing, and then you know that, well, he hasn't reacted, or she, and therefore I can feed this food. Then you can introduce others, but it has to be a novel protein, and it has to have some transitional effect. You can't just stop cold turkey hypoallergenic diet and jump on a novel protein.
Yes.
It has to be like a little trigger, and then you have to transition it over time and then see what happens. And if there's any relapse, then you're good. Then you can feed your pet potentially more variable sources and other proteins, but not the one that obviously it reacted to in the first place.
So do you advise owners, if they want to or they're used to rewarding their pets, to remove some of the diet that you're recommending they feed from their daily allocated amount in order to reward? I mean, are you as strict as that? So, if they're on a novel protein or a hydrolyzed diet and they say, but I always treat them when they come back, and I'm trying to teach them recall, or every time they sit, or we're trying to get them outside. What do they do in terms of training and treats?
In terms of treats, there are ways around it. Some hypoallergenic food is available in as canned food, and then canned food is can be given as a treat as well. You can put it in like those puzzle toys, where they can enjoy. You can cook, you can bake biscuits out of it as well. And that would be the best treat while they're on a trial. There are also treats like Vegident, for example, that is cleaning their teeth, but it doesn't have any sort of animal protein that they would react to.
Okay.
So at some point you can start introducing that and see how they cope with that. But it's basically just veggies there and soy protein, so they're unlikely going to react to it.
Oh, that's useful. I didn't even know that Vegident was as an option, so thank you for
Yeah.
giving me an option
Yeah.
for my allergic dog. And any lifestyle or sort of measures that you would advise owners to improve their pet's gut health? Anything that they can do other than obviously making a selection on the right kind of quality diet? Are there any things that they can do if they know that they've obviously they've had problems, they've had a recent bout of diarrhea, or we know that their gut has been compromised? How do you approach that?
So yeah, in general, there are also commercial foods, vet-graded commercial foods with science behind it exist, and the ones that are high in fiber, they feeding the gut with probiotics to form their own postbiotics. So, and it's been proven to form a good stool and to improve the gut health within 24 hours after starting on that diet. Once again, your vet will recommend what is best for your pet, and it would be most probably the diets that are already available for these pets that's struggling with their gut health. So investing in a good diet and prescription diet that has everything already in it, that is probably the best way to improve the gut health. There are also veterinary products as prebiotics available over the counter at your vet, and then you can always get it and give it to them.
Can I probe a little bit more into probiotics, and can you tell us a little bit about how they work? What is a probiotic?
Probiotic is a good bacteria. So, and the more good bacteria you have in your gut, or an animal has in their guts, and more diversified that bacteria is, then the better the gut health and functioning of immune cells and immune defense mechanisms as well. So that is all about probiotics. The science is whether they work or not is still out there. There's still debates, but definitely it won't hurt. And there's more science behind prebiotics and sort of feeding your own gut flora that is out there, which is more sort of working theory and proven with proven efficacy as well in our pets that is there, that can be used.
And now, a word from our amazing sponsors who make the Paws and Effect podcast possible. To make a promise implies trust. To make a pledge creates expectation. And to make a commitment initiates responsibility. For more than 25 years, we have made it our mission to take the ifs, buts, and maybes out of premium pet food. That's why our experts put the best science behind our food, so your pet's health is put first. That's why when you seek value, we strive to give you more, like protecting your pets with our free accident benefits. And when you need great tasting food, our fresh meat taste delivers. You see, what sets us apart is not one thing, it's all these things combined. Because we understand that when it comes to your pet's health, you don't want doubt and uncertainty. You want absolutes, the absolute best given your means, like premium veterinary quality food of real value that doesn't cost an arm and a paw. So rest assured that any claim we make, we stand by. It's our commitment to your pets and our promise to you. In fact, we're so confident in what we stand for that we have made the ultimate promise to you. It's called the Ultra Pet Promise, 100% money-back guarantee. A no ifs, no buts, and no maybes kind of promise. We call it our satisfaction guarantee. Welcome back to Just for Pets. You're with Dr. Cara.
Hi, Doc. It's Justin the Jack Rossi here, and boy am I itchy.
Are you on a hypoallergenic diet?
Hyper what now?
Changing to a special diet will really help. And Just for Pets have a massive range. And flea and tick medication, special shampoo.
Ooh, how quick can you get some?
Order today and we'll deliver pronto.
I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.
Let's get back to our conversation on the Paws and Effect podcast. Explain to me the difference between some of the over-counter probiotics that you get, and like you may be able to name some more, but obviously I'm quite familiar with Protexin. It's one of the ones that I tend to recommend because I've seen good results with it. And things like Canigest and the Diamex that we use particularly when we have a patient that has a diarrhea, for example. So explain to us the difference between those.
Okay. So if you have a very allergic pet, or if you have a pet with pancreatitis, then your Canigest is probably going to be not the best choice. Then I would go for Probivet or for Protexin. If you have a Diamec is quite good for toxins and to also wipe up some of the bacterial toxins as well if there is an infectious gastroenteritis. Canigest is a wonderful product because once again it contains everything, probiotics, prebiotics, and caudin and pectin, and then those are the ones that also helping to form good stool in quite short period of time.
Okay, so it's nice in terms of sort of binding.
And it's also palatable. So many,
they love it, hey?
Many pets just take it as a treat.
And can you use any of these products longer term?
So Canigest is something that is recommended to use for 3 to 5 days. Protexin, yes, you can use long term.
Okay, so the ones that don't bind, obviously, because you don't want to
constipate them. Yeah.
So Protexin you can use as a daily.
Yeah, absolutely, as a daily supplement.
And in terms of feeding, I want your opinion on this because I have some people some clients and friends who will feed their dogs once a day. Now, I'm trying to not imagine how I would feel being offered a meal only once a day. What is your opinion on how frequently to feed your pets? Is it once, twice a day, more frequently?
Look, once again, it's very individual. So some pets will just eat only once a day. They're just night eaters. They will eat at night. They will just not eat during the day. And they're active during the day. And their other lifestyle is very well balanced. And that's fine. If they don't prone to become obese, if they very active, they don't have arthritis, they don't have any gut health, then maybe once a day is okay. But there are many pets that they will benefit from 2 meals a day, 3 meals a day, and sometimes even 4 meals a day. But obviously, don't overfeed. It has to be a amount that they're supposed to get per their energy requirement per day.
And how do you determine that? So let's delve a little bit more into sort of how to decide how much to feed your pet. Are there recommendations? What are you feeding for? Because I think, often people go, okay, my pet weighs 30 kilos. Like, how do I figure this out?
Okay.
How do we go about?
So your veterinary team where you go to normally quite educated about starting from receptionists to nurses and obviously your vet. They are trained nutritional advisors, and there's always some recommendation on the bag itself, and there is a feeding chart, and then there's orphan feeding chart and recommendation for overweight pets for a normal ideal body weight and for underweight, and then you just go with that recommendation how much they need to get per day.
Okay, and then obviously depending on how many meals you divide that. 'cause it tells
Absolutely.
you in
So the
24
recommendation is always it's not 1 meal, it's per 24 hours.
Okay, so 24. Okay, good. Tell me the impact of worms on the gut. How frequently and would you deworm and why?
Yeah, so obviously parasites is another that one of the common causes that exists that impact to gut health, obviously for obvious reasons, and from puppyhood, the deworming schedule has to be quite regular. Because they often born with worms, especially if the beach wasn't dewormed regularly before they arrived to this planet. And the protocols that are there with your vet and then per your vet recommendation, be it every 3 weeks, be it every 4 weeks, just before they get vaccinated, on the day of their vaccinations, you just have to stick with that schedule, and your GP vet will direct you what product at what age you need to use, and then also depending on your area and endemic parasite problems. Like we in KZN have Spirocirculupi, which is also called a silent killer, that causes various problems, including sudden death from aortic rupture and cancer of the lower esophagus. So, and it is quite dreadful because often there are no signs, and when the diagnosis is made, sometimes it's too late to treat it or to cure it. And it is absolutely it's preventable, and there are only 2 products, to my knowledge, that exist for prevention, which is either Advocate Spot On Monthly, or Milbemax or Milpro, it's Milbemycin, the active ingredient, that is given every 28 days. There's also some other products that exist that combine Milbemax, Milbemycin, and flea and tick control, and it's also like NexGard Spectra. So it covers basically for a wide range of endoparasites and exoparasites for your pet. So it really depends on individual needs and where your pet lives and what it exposed to. Is it a hunter? Is it a Jack Russell that is going to hunt for lizards and birds and dung beetles? And this is how they get this dreadful Spirocirculupi parasite. And your vet should recommend, and you should stick with that recommendation of prevention for your individual pet needs.
Take it seriously in order to avoid these. So generally, obviously, with our upset tummies, our vomiting and diarrhea patients, we make the recommendation of a bland food or an intestinal-based diet. Why do we advise an intestinal diet? I want to understand from say, a normal diet that you're feeding, which maybe is a lamb or a duck or whatever it may be, what are intestinal diets?
Intestinal diets, they contain highly digestible protein in a highly digestible form. They do contain those prebiotics, probiotics. They do contain fiber, some of them, that helps your gut health to digest better and to improve the gut health once again.
And how long do owners need to keep their pets on an intestinal diet after having a bout of vomiting or diarrhea?
Usually it's a short period of time. It can be anything from 5 days to 2 weeks. It is normally normal intestinal gastrointestinal diet. It's usually high in fat as well, so high in protein and high in fat. So therefore, you don't want to keep it forever on this food. Some pets do well on it forever as well, but if it's an acute bout of diarrhea, obviously it's a short period of time, which doesn't go beyond normally of 2 weeks' time. And if it is a chronic problem, then there are diets, gastrointestinal diets, like the ones that contain more fiber and prebiotics, etc., and it's not as heavy on fat content, then that can be fed lifelong. Okay. If they're becoming a chronic diarrhea, chronic gastrointestinal issues.
And they do well on those diets.
Yeah, they do well on those diets.
So both considering our pets on intestinal diets because they've not been well, as well as perhaps the requirement to change from one diet formulation to another. For example, we know that there are two popular pet food brands that are exiting the market, one being Pedigree, retail pet food, as well as Vet's Choice. And so owners are either having to find alternative diets or because perhaps they're financially needing to scale back or maybe upscale to a different diet. Can we talk about transitioning from one diet, whether it's been intestinal, my dog's not been very well, or I need to change the food? How do owners go about it, and why transition?
Okay. So they go about it the way of transitioning. We recommend normally over a week. So basically our standard recommendations is first 2 days, you give 75% of your existing diet and then 25% of a new diet. Day 3, 4, it's 50-50%. And day 5, 6, it's 75% of new diet and 25% of old diet. And then day 7, it's 100% of normal diet. So why are you transitioning it and not just stop one food and start another food? Because different diets, they contain different nutrients and they have different theories behind it. Some diets, different proteins. They contain also the content of the protein is also different in those diets. So you need to give time to your gut to get used to the new protein or the new content of the or amount of the protein that you're giving. That's basically really why it was always a transition. There are some exceptions to that. So if you really think that your pet has food protein sensitivities and your vet recommends hypoallergenic diet, that diet you can start straight away. It's highly unlikely to cause any issues.
Because of the way the protein is formulated for those diets. So really, from what I'm understanding is you're saying the gut microflora, the gut bacteria ultimately needs a bit of time to adjust.
Yes.
And so what happens if you transition too quickly? What kind of signs would a pet owner notice?
They could notice vomiting, diarrhea,
do pets refuse
flatulence, reflux, pain, they could refuse it. That's basically the signs.
How do you assist? Would you suggest in those sort of circumstances of adjusting the ratio, or would you say add a probiotic? What is, or both? What is your recommendation if you've gone from, say, your 25% incorporation to 50, and they suddenly get an upset stomach? Do you say, oh, this diet is not for me, there must be a problem with this diet? Or do you just say, hang on a minute, just bear with the fact that we know that this is a possibility, and why? And what is your recommendation of going back to the original ratio of a slower introduction, or would you at that point?
Yes, you can go to slower introduction if your pet is super sensitive. But if it is recurrent problem, every time you're trying to increase it, then obviously it's not the diet.
So discuss it with your vet and see what's going on.
Yeah,
absolutely. And we spoke a bit, obviously, touched on the subject of Spirocirculupi and Advocate and some of the more preventive kind of healthcare measures that you have for your pets. I want to talk a little bit about tick-transmitted diseases. What is a tick-transmitted disease?
Tick-transmitted diseases are transmitted by tick bites. It's self-explanatory. They can be quite dreadful, and they can be fatal for your pet. So it is something that you have to be very, very cautious about, and you have to do the best protection available and the safest protection available to prevent it from happening.
And you're saying you're not seeing as much of it around at the moment because you're very passionate about it and you make this recommendation to your clients, and so you're actually seeing the result of people being more proactive about it.
So since we've had Brevecta launched, I don't know how many years ago, but we see the tick-borne diseases maybe once or twice a year, as opposed to it used to be almost every day occurrence, because the preventative care and the products that are available on the market are so much better. For example, Brevecta is good because it lasts for 3 months, and therefore compliance from the owner and the pet, because it's a tasty tablet.
Ease of administration as well as
easy administration.
life
as
gets
well.
in the way. You blink and a month's gone.
And you get a spot on for those fussy eaters and for cats as well, and it also lasts for a long time. Therefore, you control it better.
And what are some of the tick-transmitted diseases that we're trying to manage?
Yeah, so some of the most common ones that exist in South Africa is babesiosis, or people call it biliary or tick-bite fever. It is similar to malaria in people. It affects the red blood cells and causing anemia, and it causing damage of internal organs. And the other one is rickettsia. So it is like tick-bite fever in people, and it affects white blood cells and platelets in your pet, and causing bleeding, causing fever, causing enlarged lymph nodes, and there are quite a few stages of this disease. So those are two main tick-borne diseases that are quite dangerous that exist in South Africa.
And what are the typical signs that owners would notice?
The typical signs of biliary is fever, pale gums, extreme fatigue, respiratory distress. Some of them vomit and have diarrhea. That's most typical signs.
And how would your vet go about confirming that they had it?
It's a babesiosis is normally diagnosed very quickly, so it's just a blood smear, and they look under the microscope, and then they see parasites in the red blood cells.
Visible
It's visible by microscope.
And management of those things, obviously prevention is better than cure, but if you discover that your dog has related issues, or like how do
the best way is to keep your pet, hospitalize your pet, because we've seen cases when it's treated on an outpatient basis, and unfortunately they come back, and then some of the organs underwent their damage beyond repair. So therefore, they need to be hospitalized. They need to receive special treatment, injectable treatment for these parasites, for this problem. Some of them require blood transfusion. Some of them need to manage their complications, like autoimmune hemolytic anemia, when the parasite is no longer there, but the immunity, the red blood cells overreact to each other, and then it causes then self-destruction of the red blood cells.
Okay. And obviously urgent treatment is better, so not delaying, thinking.
No. If you suspect that your pet has biliary or a tick-bite fever, don't delay.
Because every hour is critical. as those parasites destroy the red blood
you
cells.
You go to emergency vet. You don't wait until Monday, until public holiday. You don't. Yeah, it's the best is it managed in hospital, and that needs to be seen straight away.
Okay, that's very good advice. Thank you, Dr. Arina. Thank you so much for your time today. I see we've run out of time and I have so many more things I want to ask you, and I'm hoping that you'll come back and we can discuss some more subjects and delve into
Sure.
your advice.
You're very welcome.
Thank you so much. It's been
You're
so
very
informative.
We have an exciting announcement to make. We are looking for guest speakers who are passionate about the pet industry and sponsors to support future episodes. Are you an expert in pet training, nutrition, or behavior? Maybe you're a veterinarian with insights to share, a pet store owner with unique experiences, or a pet product inventor. We want to hear from you. The Paws and Effect podcast is a platform for industry professionals like you to showcase your knowledge, experiences, and stories. As a guest speaker on our podcast, you'll have the opportunity to share valuable information, engage with our audience, and have your voice heard in the pet community. Whether you want to discuss training techniques, emerging pet care trends, or the importance of mental stimulation for pets, we want to feature you and your expertise. So, if you're passionate about pets and have something to say, we invite you to join us on an upcoming episode of the Paws and Effect podcast. But wait, that's not all. The Paws and Effect podcast is also seeking sponsors to support our mission of educating and entertaining pet lovers worldwide. By becoming a sponsor, you'll gain exposure to our engaged audience and have your brand associated with the love and care that we have for our four-legged friends. If you own a pet-related business, offer pet products or services, or simply want to align your brand with our pet-loving community, we'd love to partner with you. As a sponsor, your brand will be featured prominently in our episodes and our social media channels. It is a great opportunity to showcase your offerings to a dedicated audience of pet enthusiasts. So whether you're an expert in the pet industry looking to share your knowledge, or a business seeking to reach a pet-loving audience, we want to hear from you. To apply as a guest or to inquire about becoming a sponsor of the Paws and Effect podcast, please contact me at drkara@pawsandeffect.co.za. Get in touch and let's discuss the various opportunities. Thank you for joining us today. We can't wait to welcome our future guest speakers and sponsors to the Paws and Effect podcast. Remember, every episode is an opportunity to celebrate our four-legged friends.